Welcome to the fourth day of the Innovation for International Development Expo. I am so glad that you're here with us today. My name is Rhonda Hahn, and I work in global engineering, programs, and partnerships. If this is the first time you've joined the Expo this year, let me recap you on what you've missed. The first 2 days of the Expo were student-focused events. Graduate students from GRID hosted a career and Purdue alum panel with speakers from USAID, the Resilient Africa Network, Ag Connectors, and the Bill and Melinda Gates Foundation, just to name a few. We then awarded prizes for student posters. Yesterday, Purdue faculty presented their proposals for a chance at a Shah Lab Seed Grant Award, which will be awarded on Friday, May 7th. This award will provide funding for problem statements that they are collaborating with partners from CEWA, World Concern, BCHN, and Empress. You will be able to find all the recordings and content of the Expo on our website by next week. And if you would like to register for the 3 remaining days of the Expo, we will put the registration link in the chat box below. If you are interested in international development, then this is the place to be. Our moderator today is Heidi Arola. She is with the Office of Global Partnerships here at Purdue University. She is the Director of Global Partnerships and the Purdue India Partnership Director. The panel discussion today is on needs assessment and human-centric design. And so now I'll turn it over to Heidi. Thank you.
Thank you so much, Rhonda. Hello, good morning, good evening, everybody. Again, I'm Heidi Arola, Director of Global Partnerships at Purdue University. And it really is a pleasure to be here today to moderate this panel on needs assessment and human-centric design. Today, we're very fortunate to have with us the core leadership team of SEVA, the Self-Employed Women's Association in India, including Vice President Rahana Riawala, Director of Economic and Rural Development Rima Nanavati, and President Kapila Vankar. We also have Molly Fitzgerald, an international development practitioner who specializes in health equity and inclusive innovation, and Peter Masharia, the Senior Director of Operations at World Concern. Now, before I turn over the floor to our panelists to introduce themselves, I do want to take a moment to thank SEVA for even being here today, given the tragic pandemic situation in India. SEVA has mobilized an enormous response and is working tirelessly to address the overwhelming needs that India is facing today due to this COVID surge. And they're distributing masks, providing education about mitigating COVID spread, and providing quarantine centers for COVID patients, among other efforts. So if you would like to support them or connect them to resources, please feel free to contact them directly or contact Diana or Rhonda in the Shah Lab who can put you in touch. We do have their account information if you were interested in making a donation. And also just to note as well that SEVA International is not the same organization. I know there can be some confusion there. So SEVA, we want to thank you for taking time today to join us, and we're really thinking of you and all of our colleagues, friends, and family in India right now. So without further ado, I'd like to turn over the floor to each of the panelists to introduce themselves, and we'll go in the following order. So we'll start with the SEVA representatives with Rahana Ben, Rima Ben, and Kapila Ben, and then Molly, and then Peter. So if we could go in that order. Rahana, if you could please introduce yourself.
Namaste and good morning and good evening to everybody. Thank you, Heidi, for putting in the efforts which SEVA is doing for the needs of the community members in these difficult times of COVID. And we really appreciate a lot. I'll just start with a brief introduction. Like, I'm Rahana Riawala and I'm currently the Vice President of SEVA. With me, I have our President Kapila Ben Parmar, who herself is also a small and marginal farmer. And we are representing Self-Employed Women's Association SEVA, a single largest union of women members in India. And today we have organized 1.9 million poor women workers from informal economy across 18 states in India. And we also have a presence in neighboring countries, neighboring SAARC countries as well. With this brief, I'll just ask Kapila Ben if she like to introduce herself. Kapila Ben, તમે તમારો પરિચય આપશો? કપિલા બેન તમારો અવાજ આવતો નથી, પરિચય આપશો?
Sounds like she may be having some bandwidth issues.
હા કપિલા બેન બોલો.
Perhaps we should move on, and if we have the opportunity to circle back afterward, that would be great. Okay, is Rima Ben with us today?
No, Rima hasn't joined yet. Yeah.
Okay, great. Then let's move on right now, given the bandwidth issues. So Molly, could you please introduce yourself?
Thanks, Heidi and Brianna. I'm very pleased to be here. My name is Molly Fitzgerald, and I am a public health professional. I have been working, in a variety of contexts and wearing, I guess, a few different hats over the last many number of years. I won't say the number, but, ranging from programming to research and innovation. And as you mentioned, I've worked in a lot of different settings and contexts, but the interest and the focus has always been on really trying to understand how best to work with communities and prioritize, understand what the needs are for equity across the health system. So to me, although I've worked in the actual health service delivery part of the health system, I find the most interesting things are sort of in that community health system space, which is sort of outside the walls of the health facility. And I'm so excited about this conversation because I've seen in recent years a huge potential to integrate human-centered design and approaches to doing that better. So thank you for having me, and nice to meet everyone.
Thank you so much, Molly. Peter, could you please introduce yourself?
Yeah, thank you so much. I am Peter Macharia. I am excited to be here today. I'm the Senior Director of World Concern and based here in Seattle. And we have been the organization for 17 years, but I have worked mostly in Africa, where I was, I served in different countries. My major interest is in poverty alleviation and how grassroots movements do that. I take a keen interest in economic development and how people come together to transform their lives. And so basically that's me. I'm excited to be here and looking forward to a robust conversation. Thank you.
Thank you so much, Peter. Wonderful. So without further ado, we've asked each of the panelists and organizations to provide their thoughts on needs assessment and human-centric design, mentioning their approaches as professionals when they're dealing with international development projects and programs. So I'd like to start with Seva. Rajani, are you ready to share your presentation? And each of the panelists will speak for up to 10 minutes to provide an overview before we get into the discussion. And I think, Rajani, you're on mute.
Sure, I'll share the screen. Is it visible?
Not yet.
Okay. So let me start with what informal economy in India is and its reality. Almost 93% of the total workforce in India is from the informal economy, and majority of them are women. They are the ones who are highly productive, economically active and enterprising, and also contribute a lot in say nation's economy. 62% of the GDP, 50% of the national saving, and 93%, 39% of the total export comes from the informal economy. Despite of that fact, it is that they are the ones who are the poorest of the poor. They lack visibility and recognition. They do not have very low or say less protection under the law, restricted social protections. They are not included in policy dialogues and labor economic policies. Their working conditions are very poor. They work hard and earn very low returns. And they do not have any or have a very low access to markets and equipments. So this is the reality of the informal workers. And so Self-Employed Women's Association was established in 1972 by Srimati Ilaben Bhatt, and today we have a membership of 1.8 million poor women workers across 18 states in India, and we also have a presence in SAARC countries, neighboring SAARC countries. Now, the profile of the members is such that they come from more than 125 different trades, but then we have categorized them with major 4 categories. They are the home-based workers, street vendors, manual laborers, service providers, and small producers. Twin goals of SEVA is full employment and self-reliance. By full employment, we mean employment that provides with income security, work security, and social security as well. And by self-reliance, it's not just economic self-reliance, but then we also see to it that how do we, the decision-making power of the women members also increases. We are, today, we are a confluence of 3 movements: trade union, labor, and women's movement, and with Gandhian values and principles at its base. To achieve our goals, we follow an integrated approach and joint strategy of struggle and development. The approach, integrated approach, what we mean is organizing is first and foremost, because they are the one who collective organized get the strength, and through that we are also able to influence the policy making, and that is how the voice, visibility, and recognition takes place for the informal economic workers. We invest a lot in capacity building, which would technical as well as managerial capacity building, which would help the poor women workers across the informal economy to increase their skills and become, not remain the workers, but they also become the owners and managers of their own work and enterprises. And at the same time, it's also this would allow them to be competitive in the market as well. Thirdly, we invest a lot in capital formation at the individual as well as the collective level, so that we at SEVA believe that capital formation or the asset ownership is the surest weapon to fight poverty. It may be in the form of small little savings, or it may be in the form of tools and equipment of their own trades. And lastly, we also look into that the social security is there. So that helps the members in mitigating the stress and crisis, chronic health problems, and protect erosion of the income and their assets. So talking about the strategy, it says joint strategy of struggle and development, wherein through a union, we have the struggle for wise visibility recognition of these women workers, and the development activities allows women workers to increase their bargaining power and offers them the alternatives to enhance their income and social security through collective actions and in the form of enterprises that are again owned, managed, and controlled by the members themselves. Coming to the women-centric approach at SEWA, we at SEWA are, say, very much need-based and demand-driven. Our approach, we look into the issues of the members, and then we work towards the issues and the needs and demands of the members. And in this approach, like we do have continuous contact and meetings with the members, and like we have a leadership team from the village themselves, from their community themselves, and they understand the issues and demands of this of our members, and then we work accordingly. We also do a lot of, say, small participatory research and studies to understand the issues and needs of the members. Alongside, like, it's not that we work on, like when we talk about our integrated approach or say any of the issues we are working in, it's not that we work on a silo basis, but then we look into it, how do we have an integrated or an holistic approach to the needs and the issue of the members. And at the same time, we at SEWA have a very, say, decentralized and democratic functions, which is grassroots up, wherein from the members themselves, we have the trade committees, we have the area committees and trade council leaders. And these trade committees and trade council leaders form the executive committee, which is the topmost, governing body at SEWA. And this is again done in a very democratic manner. So we have the elections of the trade committee and executive committee members every 3 years. So the structure at SEWA is a very much bottom-up approach and like the grassroots up approach. And lastly, we believe a lot in community ownership and participation, because this is how, like, the members themselves design, implement, and monitor any of the programs or say any of the activities that needs to be taken place. So the participation of the members is in each and every activity, and therefore the ownership and the sustainability also comes in. So as I mentioned that like it is owned, managed, and by the members themselves. So the leaders of SEWA are the one who are really driving SEWA ahead. And then we, so as I mentioned earlier, the area specific and demand driven approach, wherein we also look into, say, the existing traditional resources or say regional characteristics and local needs and skills available in the among the community members, and then we further work towards building the capacities, which is a continuous process, which may be in the form of, say, leadership or say technical and skill building. We do also have SEWA Management School, which provides with the managerial training and all. We at SEWA believe that given the opportunity, the members, say the poor women have that capability to run their own enterprises. So we facilitate our members to build and operate their own organizations by forming cooperatives or say district level federations, or lately we had also gone for profit and not for profit companies, which are owned and managed by the members themselves. And thus this way we believe a lot in privacy of the local ownership and the knowledge. So we invest a lot in the village women members and build their capacity so that they own and manage their local economy organization. We also do not believe in say duplicating of the efforts. So we also do a lot of conversions with the existing government and non-government programs and schemes, and we link with that. So we do not do any parallel efforts, but wherever applicable, we link our members with the existing government schemes as well. And lastly, it's also how do we build upon human capital of Seva leaders in the model of solidarity and sisterhood? So we do share, there is a lot of experience sharing and lateral learning amongst the members themselves. And that is how the scaling up happens. And again, those experiences and scaling up are based and adaptable with the needs and demands of the members in that particular district, state, or region, whatever it may be. With this, I'll invite Kapila Ben to say her experiences, and then we can move forward on.
Kapila Ben?
Kapila Ben? Kapila Ben, તમે છો? તો તમારો અનુભવ કહેશો? I don't think she's there, but then, so like, we'll wait if she can come, or else I'll continue with the presentation. Yeah.
Rihanna, please let me know which slide to be on. That way I can, I don't want to go too fast for you, and I'm not sure. I can.
I'm able to see my slides, yeah.
Okay.
Is this visible?
Oh, wait a minute. Go ahead and try to share your slide again.
Okay, is it visible?
Yes, yes.
Okay. So I just come up with an example of, say, how do we work on, say, issues and needs. So like when we were working in the rural areas, we found that majority of the women, as you all know, in the rural or at Seva, like 2/3 of the membership comes from the rural area, and majority of them are involved in agriculture and allied activities. And so like a big question to us was, how do we make agriculture sustaining? And at the same time, while working on our agriculture campaign, we found that despite of so much of efforts, like these are the members who the small and marginal farmers are the ones who remain hungry. And so working on this issue, I'll just share with some of the work on how we integratedly or holistically work on these issues. Under the Seva's agriculture campaign, we increased the collective strength of the farmers, and we provided with easy and timely access to credits, capacity building, and technical trainings for scientific and organic farming. We do worked on, say, providing market information and access to direct marketing and market linkages as well. And at the same time, educating them with the certified inputs and the groups of the small and marginal farmers acquire the licenses wherein the fertilizers or say certified fertilizers could be sold. And then at the same time, for the risk mitigation, we also worked on agriculture insurances, healthcare, and crop insurance and all. Alongside that, we also the small and marginal farmers also formed their own for-profit company, which is Ruri Multi-Trading Company. And today it's an enterprise of agro-value chain established by the small and marginal farmers themselves. And it aims at providing the food security to the poor farmers and the direct market linkages. But alongside that, it also creates and strengthen the multiple employment opportunities and livelihood and value addition to the farm producers, which includes processing, packaging, marketing, etc. At the same time, we are also working on, how do we, because working towards that, we also found that the weather related information and forecast to the members are not available at a micro level. So at the same time, we are also working with the weather department and the agriculture universities to say how does we avail the weather information and forecast to our members so that they could take decisions for harvesting the crop. And at the same time, this is also one of the same needs which we are working with, say, the Shah laboratories at Purdue University for micro weather stations in the villages itself. And these are the poor members who are often affected with with the disasters. So currently we are also working on how do we set up the financial mechanism for these poor women workers. So we are working on how do we build resilience building towards various disaster and shocks for the women in the informal sector and in the agriculture as well. So this is how integratedly we are working on the needs and issues of the members. So today, the poor women members of SEVA are, say, trade representative, are on the executive board members. They operate and manage more than 6,000 producers and self-help groups, more than 100 cooperatives and their federations. They have the marketing organization and say SEVA Trade Facilitation Center and Rudy Multi-Trading Company. They manages the finance at the SEVA Bank, which is also one of the cooperative bank by the SEVA members. They are the shareholders in the companies. They are also the students and faculties at the SEVA Managers School. They use technologies like computers, mobile, satellite communication, and WhatsApp chats, etc. They are also the barefoot water technicians, health workers, teachers at the childcare centers. They are also working towards mitigation of climate change. So this is how holistically we work around the issues and needs of the informal economy workers. And again, this is say the ownership rests with the members themselves. So talking about the impact of what, because as mentioned earlier, we do believe that the poor community do have the talent. And so we were, SEVA has been able to bring out the talent of the poor community who are and explore the opportunities by themselves. And today we have an improved and collective strength and bargaining power of the community members in each trade and in each sector. We have been successful in, under the leadership of the woman. It's not the woman herself, but it is the family as a unit which has been served. So it's under the leadership of the woman. Then we are also able to work on the sustainable employment and create alternate employment opportunity that leads to, say, poverty reduction. And at time of disasters, the work has been also lead to, during the disasters, we also work towards how do we rehabilitate, and at the same time, counseling and related work is also been done. And that really empowers the woman to fight against all the odd situation they are facing with. Few of the lessons learned is that all that the poor needs is, say, facilitation in opportunities, technical and financial support and services. Then it's really, say, important to invest in the process, because it's not, say, for a time being or say for a project or the program, but then it's an ongoing and time consuming process. So one really has to invest in the process and stay connected with them. And it needs a very well coordinated approach in an integrated manner with the woman at the center. And thus over a period of years we can see the sustainability and really upscaling the economies is a challenging task, and we need to work on that at the pace of the women members which they can take. Thank you.
Thank you so much, Rahana. So we're going to let all of the presenters give their opening remarks, and then we'll have questions afterward. And just in terms of form, we'll take those questions in the chat box, and then I will address them to the panelists. So if we could please have Molly, invite Molly to present now.
We do have Kapila Ben over here, if she can talk for a few minutes. Kapila Ben,
we're at 20 minutes now, so I think it would be better if we move to the next presentation, and then during the discussion, I would very much like to hear from your colleagues.
Sure.
Okay, Molly.
Sorry, can you hear me?
Kapila Ben, આપણે તમારે પછી બેન પછી બોલવાનું આવશે. પહેલા મોલી બેન નું પ્રેઝન્ટેશન પતી જાય ને એના પછી.
Sorry, should I go ahead?
Yes, please go ahead, Molly.
Oh, all right, cool. I assume you can see the screen. Yeah, so I have just a few slides, and I wanted to speak a little bit. That was a really great presentation. I loved learning more about SEVA. I've always heard great things about SEVA, and so I think what I will speak about in just a few slides is really looking at a specific, approach to human-centric design. As I think you could there could be a generic interpretation of human-centric design, which could encompass a lot of different things, and then and whereas I'm going to speak sort of specifically about one particular approach, and wanting to look a little bit just about some of the potential and the benefits, as well as kind of looking critically about what we would need to do to actually have it have a good impact. And I'll look specifically at some issues around equity and inclusion. So I always think it's I find in working, particularly in public health, and I'm very public health centered, but I see everything as public health. So although I am speaking about public health, I think this does apply across lots of different sectors. And in fact, that's one of the points that I'll get to later as an opportunity with human-centered design. So I think in kind of a traditional public health assessment approach, some of the key distinctive features are that it's analytic and evaluative and sort of descriptive, whereas a human-centered design approach, both can be person-centered. Human-centered design does incorporate a lot of ethnography and qualitative research. So I think there are some overlaps, but the part that really excites me, and where I think there's a specific opportunity in this time right now, and we've seen it like very kind of right in our faces with COVID, but I think this is, it's just symptomatic of so many other things that we're seeing, where human-centered design actually involves generative thinking, which is really lends itself really well to kind of solving vexing problems that we don't have a solution for. So, the traditional public health assessment approach, or I think many assessment approaches, starts in a particular framework. You're looking at kind of the evidence. There's engaging the community, which can mean quite a lot of different things, and would be fall on a spectrum of kind of more authentic, I think, to sometimes less authentic. Whereas human-centered design is really drawing on a different mindset. And another area I think that's particularly a particular benefit and an opportunity is that there is built into the approach is the expectation that that humans or the people who will be benefiting from what you're assessing to respond to have the solution. So it really focuses on that area first and foremost. And I use this slide so many times because I think it really resonates, and it's so important, and we can sometimes lose sight of it in our work. But just the Einstein quote about, if I had an hour to solve a problem and my life depended on it, I would spend the first 55 minutes determining the proper question to ask, so that the solution would actually be responsive to the question. And I think that completely, hits the nail on the head in terms of the most tremendous opportunity for using human-centered design in assessment, because in the assessment is where researchers or programmers or policymakers or innovators are saying, we need to build 100 houses, we need a lot of hammers. Well, that's okay if you're gonna, if that's the right, if that's the need. But if the need is, if you're asking the wrong question and you really need scissors, or really it's about food, or you're sort of misguided, then the entire process, I think, in the solutions is where there's a lot of pitfalls. And I think I'm sure all of us have seen this in one way or another, whether it's from data and during our work just on a daily basis, or with big problems with COVID or anything else. One thing that comes to my mind was some research I was doing with people living with HIV who are accessing treatment in rural South Africa, where early on in the epidemic, this was many years ago, and there was this assumption from the experts, that people couldn't adhere to the treatment, they couldn't, wouldn't be able to adhere, and it was sort of focused on a behavioral thing, which would lend itself to, if you're looking at it like that, then the solutions would be like setting timers, or making it clear what to take and when to take it. And this was just completely turned on its head for me when one of the women that had missed an appointment for the treatment said that the reason was because she was walking her daughter to school and she got hit by a car, as there were no sidewalks. And so she obviously, like I think any of us would do, took care of her daughter first. So that's kind of you can imagine any number of ways that you could, center if you were working with that woman, or if there were many women like her who really had a lot of other concerns that were completely outside of like the health system. So I think that is just at the core of this kind of approach, is really taking the time to ask the right questions, understanding the problem through insights, and solving, for the right problem. And then in the third point, I think the other opportunity with a human-centered design approach is that you're very quickly, in some cases, just right up front, moving towards the solution. So it's not a year-long or month or 2 or 3 month long evaluation for the wrong problem. Instead, you're working towards solutions, and you're quickly finding out if those are the wrong solution. So it's tied to the solution straight away, as opposed to just being descriptive. And it's also it's also designed in such a way that the right problem would be addressed if it's done properly. And I just can't think of anything that's more important in this day and age where we have so many, vexing challenges like climate change and COVID. How are we going to roll out so many vaccines across the world and things like this, where there's so many other challenges that have never been faced before. So this is, I wanted to note that this is taken from, I think, well, HCD for Health, but UNICEF also has an extensive human-centered design toolkit on their website. USAID is talking about human-centered design World Food Program. Like, it is a standard among many donors, multilateral agencies who are, investing, and many implementers, I think, are talking about this approach for these different reasons, because there's a desire to, sort of fail fast or save money, so you're not spending a lot of time and money on the wrong solution, so that there are innovative solutions that are needed for challenges that we don't have solutions for. And, I think there is this promise of reducing inequities, and that's so exciting to me, but I do have some caution about that. And then also, I think just because it's quickly jumping to the solution, in some ways it saves time. So here's another, sorry, are you able to see the full screen? This is an article from Nature that I just thought was interesting, because it's talking about a very similar thing of looking at a public health problem, COVID, and when the exploration was with a particular community, agricultural community, and the opinion author, points to all of these other challenges that have nothing to do with what we traditionally talk about as public health. So economic, social barriers, a whole, looking at just the range of things that affect people's ability to be healthy and to thrive. And this, so I think this sector, kind of this ability of human-centered design to not be tied to a sector orientation is an asset, because it helps to kind of break our usual patterns of thinking, like, oh, it's public health, so we look at the literature, we do the assessment, like this is how it's typically done. Whereas this approach does actually really allow you, as this opinion author, calls for, like, can this actually help us to break out of a mindset like where we're saying there's lots of social determinants of health that are leading to health disparities. This has been part of research and programming for over 150 years or longer, and yet the progress is too slow, as I think we're seeing in a lot of spaces, and there's a lot of recognition of that right now in particular. And so I think that's why this particularly is a huge opportunity. There's a potential to strengthen the relevance and responsiveness of the solutions for specific communities. So instead of needing to have a large population-based survey, you could do that as part of a next step, but you can and are very much able to easily, with human-centered design, directly go to the communities who are left out, the traditional evidence maybe points to that. So it's sort of a shortcut in a way, but I think in a good way. But one caution that I just can't emphasize enough is that it's not it's not automatic. So I think this is my concern, is as it becomes kind of so mainstream, that even, and you saw in the former slide, like there's this just sort of almost assumption, like it reduces inequities. Well, I don't think it automatically does unless it's done in such a way that it does. So the way to ensure that it does advance inclusion is to actually ensure that, you know, the design team is diverse, and that there's sort of a design by, or, you know, with, as opposed to for. So in many ways, I think that's the same as any traditional approach. You still need to do that. So it's an imperfect solution, but I think it has just tremendous potential. And they're, you know, critical, just, you know, adding onto the ways that it can have a greater impact, I think, is ensuring that assumptions are documented and challenged along the way. This is part of human-centered design. It's an explicit part and a core feature of the approach. And then actually having questions that are framed like designing for equity, but that when you're doing that it's, you know, the community who is affected is actually driving that conversation. And so, yeah, I think just there some of the challenges might be to generate evidence around these approaches. So these approaches are seen as riskier and may require more upfront investment. So there could be cost effectiveness, you know, analyses to actually look at what it was the outcome and what was the cost versus the potential cost of doing the wrong solution, having to redo, or, you know, et cetera. So again, just reiterating the point that it's got the greatest potential when there's authentic engagement, you know, and design by and with people who are affected by it, whether that's research, programming, or innovation. So I just wanted to leave on these questions for people to consider, and just maybe think about, you know, what opportunities you see for human-centered design in your work, and what are the barriers. And then these were just 5, you know, really core challenges that I think are very amenable to a human-centered design approach, because we certainly don't have the solution. We have lots of things that would help climate change, but we don't have the solution for, you know, quickly changing the way we do things. We don't have the solution for equity, and we certainly are too slow in achieving sustainable development goals. In fact, we're not. There's a, you know, pending humanitarian catastrophe with climate change. We're seeing there's going to be increased pandemics, and then just kind of reimagining the entire structure of international development is another thing that actually, as a process, I think we could actually use this process to do that. So then again, just a couple of my favorite quotes, like, if you keep, you know, doing the same things over and over again and expect different results, then, you know, it's not going to happen. So I would just, yeah, I think we clearly, there's a lot to be done, and we can do better, I think. And so, I would urge people to consider these approaches with these caveats. So thank you. Just hand it over to Pierre.
Thank you so much, Molly. All right, so again, we'll save the questions to the end if you can be thinking about those. We'll move over to Peter.
Thank you so much. And let me share my screen. Yeah, so you can, I guess you can see that. Yeah, so you know, thank you so much. I think I really liked Lehema's presentation and Maury's presentation, and you know, Maury's presentation was more of the process, and I want to pick up from there and say, you know, just speak about the things that we have found as we have implemented this kind of design. So as I said at the beginning, I'm Peter Masharia from World Concern, Senior Director of Operations. And, you know, World Concern, you know, is a Christian humanitarian organization that has been serving the poorest of the poor since 1955. We are currently in 13 countries in Africa, Asia, Middle East, and Latin America. And what we have found is that, you know, as you serve communities, there are things that are same, but their communities are different and they need to be treated that way. We take a long-term view to development, issues of integrated development approach, transformation development. When we get into a community, our purpose, our desire is to stay there long enough to create an impact and to leave a community in a state where they are able to do some of the things that we came to facilitate, do by themselves. We invest a lot of time and resources in understanding the needs of the community and the community itself, developing rapport with the community. We spent actually a whole 1 year, just developing relationships, trying to live with living the community, understanding why things are the way they are, and them and the community understanding us. We try not to rush at things. Of course, there are times when we do relief work and where we just meet the need. But after that, we work with the community in such a way that we clearly understand who they are and what their needs are. We also build a lot of community ownerships and strengthening of community structures, because we realize, if we don't do that, what we do with them ends up being ghost projects that probably will not be sustainable, and projects that will be already associated with world concern. And they will be saying, that is world concern well, that is world concern water pan, that is world concern thing. There's no ownership. So we take a lot of time to build those structures, community structures that will facilitate ownership. And what we have found is that, if you don't do that, then, you end up failing a lot. We also try to structure assessment to ensure there is all the segments of the community are represented, are reached. And so we structure the way we work with the community in such a way that everyone feel welcome, feel at home, they feel they can make a contribution. So as I said, I want to look at some of the things that we have found. And basically today, I just want to talk about 3 things. Number one, being program focused, it's past needs assessment, and most of the needs assessment approaches focusing on the problem, having an extractive mindset, and that's how communities see us. The question is, when you go to your community members and you're collecting data or information, what is the psychology of the person you're interviewing? What do they see? They see an intellectual coming with a pen and a paper, extracting information from them. So that's how they perceive it. And that distorted, that is not structured well, it distorted the whole purpose of doing this exercise, because they would treat you as such, somebody who is extracting, somebody who is mining, somebody who is drawing from, And then there's a lot of intellectual dishonesty and what I call intellectual robbery. And we'll talk about that as we move on. So the first thing I want to talk about is problem focused and versus people focused. I think, as Maury have said, I think the whole question of what is our focus? When you're doing the need assessment, what is your focus? Are you focusing on the problem? Are you focusing on the people? And many times, and most of the needs assessment have focused on the problem, but human-centric design really focuses on the people, because it's about the people and their problems. So the people comes first rather than the problem. And one of the challenges that as researchers, when we go out there to the community, they see us as tourists, So they see us as people who are coming to collect data and then they'll go. And the thing is, they see this a lot, because as an organization, we go there, we collect data. Following week, somebody else comes with a questionnaire. Just, what are different? They collect the same data. The following week, the same. The following week, the same. And those people just come and go. Some respond and come and work in the community. Some don't. Some researches is just for research purposes. Just collecting data either for a master's degree or for a PhD degree. I remember when I was doing my master's about 20 years ago, I went to a village, and one of the farmers looked at me and said, "Young man, I'll answer all your questions, but remember, I'll demand one thing from you. if I tell you all my problems and then you don't solve them, whatever will beat, you'll have to pay for it, you know. And he was sure that you'll find me probably 5 years later along the line and question me why I didn't answer their problem. And this is because they have been asked the same question again and again and again. So the whole questions of being seen as tourists, if we focus on the problem, then there is the issue of misdiagnosing the problem and providing unfit solutions. If you look at the picture on my right on the screen, I guess you can see these are mosquito nets. This is a picture that we took some few days ago in South Sudan. These are mosquito. This is not our work, but it's somebody's work. These are mosquito nets that have been distributed by an agency that thought community. Of course, they serve a lot of malaria, and so they wanted to solve the problem of malaria. So they gave them mosquito nets. Little did they know that this community have tons and tons of mosquito nets because other NGOs have been doing that. So they saw the problem and they wanted to solve the problem. And solving the problem is provide treated mosquito. What happens to the farmers? I mean, to the communities. The community turns them to be. They use them to fence their farms because they have extra. So this is a problem when you focus on the problem rather than being human-centric design, asking the question, why? You know, so one of the solutions is ensuring that you allocate a lot of time or resources to understand the why behind the why. For instance, asking yourself, why is it there's a problem of malaria here? They'll tell you probably because of mosquito nets. We don't have mosquito nets. Then they ask questions. If you are providing mosquito last time, why are you not using them? And probably they don't know how to use the mosquito nets. You know, probably they don't understand the values. So the issues of behavior, you know, how are behavior formed and how do we develop behavior? So those are questions that need to be asked, and those are questions that comes in a human-centric design. And then solutions that are cultural sensitive. You know, I was, again, in another place, I was in Kenya. We were doing an assessment, and we went to a community and we found a community feeding their goats on sorghum that has been distributed by some organization. And the question I asked the community, why are you doing this? Why can't you eat this? This is food that has been brought to you from abroad, you know, by this organization because you're hungry. There was a huge famine. People are actually dying. And they said, you know, we have never eaten sorghum in our lives. We don't know even how it is cooked. So why it's for animals. So they were feeding goats, you know, but elsewhere where this sorghum came from is used to feed people. So, and the people who brought it thought people could, yeah, we could eat this, but in the culture, they don't eat sorghum. So the whole question of being cultural sensitive, you know, is central to human-centric design. And if you miss that, we will see people that are hungry and you think the food that you eat, they should eat it. And you supply it, they will give it to chicken. The other thing that we probably need to look at is the whole question of extractive mindset versus transformational mindset. When we are going to do research, the question that could come to your mind, you should come to your mind is, how will my research or my assessment into sale bring transformation? Because what we think in most of the time is we think about doing the research and then doing the work to bring the solution. But what we have found is that the research part of it should be transformational enough that you leave those people in a better place. That the way we structure our questions should help the community start thinking, okay, so we could do this way. So we could think that this way. But most of the times when you go in an extractive mindset, we're asking about what is your need. What we have found is that probably we need to go a step further, not focus on the need, but focus on what they have. Not on what they don't have, but what they have. Because when you focus on what they have, then they start seeing, oh, we have this. We can use this to solve our needs. We actually don't need foreign assistance. So, and because of that, there's a lot of fatigue, you know, like that man that I've told you about. He have answered these questions many times. And because of that, he's now grown fatigued with all these questions. We go back there with that nice pen and paper, looking nice. We ask those questions. But these farmers, we don't care about how many other people have visited this farmer, asking the same questions. So there is a lot of fatigue among the people being asked the same questions. In fact, when you go there, they will tell you, we are tired of these questions. You people go sit somewhere. We gave this answer to somebody, go ask him. But we don't know each other. And so that's where the problem is. We probably to have more of a coordinated approach in the way we do assessments. And then the whole question of beneficiary protection issues, where we collect data for people, very specified data. Like I saw a questionnaire the other day that I was asking somebody about how much do you make in a year? And I asked that person, if I came and asked you in front of your children, how much do you make? Would you answer me? A stranger coming from somewhere and asking you, how much do you make? Some of these questions are very personal. So you really need to ask yourself, how do we even ask those questions that will help us achieve our goal, but still showing respect and showing that we understand these people need some protection. So customize our research to be a learning platform for all, that the people who are participating answering questions, they are not just getting answers to you, but through that process, they have a reflection. There's a reflection mode that help them see, oh, okay, I think you have asked a very good question, and I think this is what I should do. They don't just give you information so that you solve their problem, but you ask a question that helps them to reflect and start thinking, oh, how can I solve this problem? Using something that you have been using, appreciative inquiry approach, other than just going there to ask needs assessment, where we are starting from what they have and what they are able to do, than focusing on the need. Because when you focus on the need, they actually they create even needs that are not there because they think you have all the dollars. And toward that, interaction dishonesty and robbery. We've seen this a lot. And one of the things that we have found is that, we go there, we find innovations, we find things that people have been able to do, and we get them, we go out there and improve them a bit, and we call them our own. We patent them and we call them our own. And the people there, they are left, they don't benefit, So one of the things that, we probably need to think about, how do we tap from local indigenous knowledge, the knowledge they have? You see to the farmers out there, and they'll tell you, when we see these birds passing by, we know the rainfall season is about to start. When we see trees producing this kind of flowers, we know the rainfall season is about to start. When we see this kind of animals, we can actually tell you there will be a famine. And they have observed this over the years and years and years. They have a lot of knowledge, indigenous knowledge. And it is not proven by science, but it's proven by practice, because they have been there. So how do you tap from that and still give them the due recognition? I call them barefoot innovators. People who are there, who have nothing, but they are able to detect and be able to find things. And how do we recognize them without being seen as if we are stealing knowledge from them and claiming it's ours? How do we ensure that if we actually are recognizing, patenting something, or probably coming up with a theory that has been proven by the community, we actually attribute it to them, and they're actually part of the recognition? How do we create a win-win approach where they see they are winners, they are not losers, and you get the data you want, but they also be able to get the recognition that they deserve. And finally, some of the things that we've also found is, in dealing with this issue of beneficiary protection and ethical standards in research, I think that is critical in human-centered design, that we are not using people as subjects, and we are protecting them from ensuring them that we don't use data without their knowledge, like we don't take pictures without their knowledge. They have consented to that, they have agreed to that. They have said, yes, you can use those photos, like the ones I've shown here. Those are photos that we have permission to use. And that is helpful for them. Issues of local knowledge centers, as I said, one of the issues we face is lack of coordination in data correction. Like I know some places like in Kenya, in South Sudan, and other places I've worked where research has been done, a lot of research has been done. Could we be able to help the government create like an archive or somewhere where about most of the data, this information is stored and people are able to get there, to get to that, and it can be stored on the cloud. It can be stored on the software, so where somebody can be able to get it, so that we don't have to go to the community for the same information. Issues of collaborations. If you're a researcher finding a place like an organization like World Concern that has a long-term view, a long-term presence, and I like Purdue what they are doing, collaborating with the research institution, collaborating with local organizations that are doing development. So thank you very much. I think that's all I had for the time given.
Thank you so much, Peter. So at this point, I am going to kick off the conversation with a question, in this case for Seva. However, and I do have other questions here, but in the interest of time as well, I do want to make sure that all of our participants, all of our audience members have a chance to ask their questions. And so I would kindly ask you to start putting them in the chat function, and then I will read them. But I'm going to start with a question for Rahanaben. So Rahanaben, in your slides, you mention how Seva, especially in the slide about the wheels of Seva, how you converge with existing government and non-government programs and schemes in some cases. And so I would just like to hear more about how you, or the techniques that you use and how you advocate for your stakeholders, especially when perhaps programs and government expectations / donor expectations may be slightly different than those needs that you've identified from your community. So can you speak to that, Rahanaben?
Yeah, let me ask Kapilaben if she can come in over here, or else I can be speaking on that. કપિલાબેન, એમનો પ્રશ્ન એવો છે કે આપણે જે કહીએ છીએ ને કે સરકારી સ્કીમ્સની જોડે આપણે કન્વર્જ કરીને કામ કરીએ છીએ ને કહેવાય કંઈ ડુપ્લિકેશન નથી કરતા, તો સરકારી સંકલન જોડે આપણે કેવી રીતે કામ કરીએ છીએ ને બીજું કે આપણે કહીએ છીએ કે આપણે જે બહેનોની જરૂરિયાત પ્રમાણે કામ કરીએ છીએ, તો એ જરૂરિયાત પ્રમાણેના કામોને આપણે કેવી રીતના લઈએ છીએ, એના વિશે તમે કંઈક કહેશો?
અવાજ છે મારો?
હા, હવે બરાબર આવે છે. તમે
હેલો,
હા કપિલાબેન, હવે આવે
છે
એટલે હું
ચોક્કસ એટલે ખાસ કરીને
Okay, I think we're having some connection difficulties. It was really nice to at least see Kapilaben and know that she's joining us today. So thank you for that. And I think just given the connectivity issues, it would be best if Rahanaben answers.
So, I just come into it like we at Seva don't believe in duplicating the efforts, and so we do a lot of convergence with already existing government schemes. If we take an example during the COVID situation as well, the ration was distributed by the government department in this year, so they haven't come up with that. But then last year they have been distributing the ration distribution was done under the Pradhan Mantri Yojana. But then at the same time, we saw that the distribution of, say, the food kit, which was done under the government scheme, was not enough for the family. And then certain items in those food kits was also not, say, sufficiently looked into it. And so alongside our Rudy multi-trading company, we work with our leaders that what else could be, what are the needs of the members during those tough times when the lockdown was there. And so we provided with those kits to the members so that along with the ration kit from the government and say the kit distribution from Seva would suffice for the food security. And like today also, the situation in the rural areas and in the urban areas, both are very difficult. There's no tasting kit available. At the most, what is being done is say rapid antigen test, and there is no, even the RT-PCR tests are not there with the government. And at the rural areas, the health infrastructure is really, really very poor in the rural areas in India. And so we have been working with government on say writing to them on providing this health facilities and medical facilities in the rural areas. Even say the government authorities at the local level are also say asking Seva if we can write to the government at the state level as well, and then if the say medical supplies would be enough. And at the same time, like the members have a very small houses and they are not able to isolate themselves if they are found COVID positive. And so at the district level, we had the Seva centers. So we had written to the government and we are working on it. How do we convert those Seva centers into the COVID, say, isolation centers or the quarantine centers? So this is how we work very closely. Whenever, like in last year, when the ration distribution was being done, at that time also, like many of the migrant workers were not enrolled and then they were not provided with the food, but then Seva would work with the panchayat authority, which are at the village level, the government authorities at the village level, and then would see that the enrollment of these members are done and the ration has been availed by the members themselves. And similarly, like this was an at the same time, when we say we look into a very integrated approach, so today also we are working, we have taken it as a campaign. Today also we are working on the distribution of the mask for the members and creating the awareness education programs for the members. So in that case also what is happening is, say, we look in a very integrated way, so that like we also worked with our members, wherein the members themselves would produce the mask, and then that would also work as a livelihood opportunity for the members in this tough times. And at the same time, the logistic related cost would also be nullified, and the members would get security and preventive measures with the mask distribution, which we have taken up as a campaign. So these are certain few of the examples which we have been working on that. And then apart from COVID, like we have also been working with the government on a lot of advocacy related work is also being done. Say when we talk about, say, NREGS, which is one of the biggest employment guarantee scheme in India. So what we do is we have the village level plans prepared by the community themselves, and they will produce it to the panchayat, and then those work related to that, whether it be watershed related work or whether it be livelihood related work. So we will see to it that how those work also get done under those schemes. At the same time, we have been very instrumental in getting, say, the few of the very important acts, like the Act for the Street Vendors and say Social Security Act for the unorganized sector in our country. Seva has been drafting the policies and advocating a lot with the government, and then that act has been in place. So this is how we work with the government and see wherever convergence is possible, we do that.
Thank you so much for that detailed answer about Seva's advocacy efforts, Rahana. The next question I have is for Molly from the audience. The question reads, in my experience, I feel sometimes that what we miss in human-centric design is accounting for the misses or mistakes that humans will make and designing for the fallback right from the beginning.
Yeah, I think that's a really good question. And it gets at the mindset. And I loved the way that Peter talked about, thinking transformationally. But another So I think that's one thing, you know, and human-centered design really calls for people to think big and start small. And I think that's the key, is that we don't, it is true. We have, you know, as you start out on the process, there's a lot of generative thinking, and the human tendency is always to say, oh, but we can't, that won't work. But that's like not allowed in human-centered design. And so I think if there's real kind of, if you really trust and follow the process, I do think that it can get around that. And then, you know, also just as Peter was saying, to kind of think transformationally, thinking big and starting small, and not being afraid to fail. And then I guess just the last thing that I would say is the process is really focused on, you know, it's an iterative model. And some designers say, you know, you should make it to break it straight from the start, just so that you're not worried about this perfect solution, which is just, it seems like we're just hardwired to want to do that. And you know, development, I don't actually like the word development in the international development context, because, you know, humans are evolving, everybody is changing, and we all have different goals, personally and in countries and different cultures. So I don't think there is a right or wrong per se, but people definitely know what they need. I think that I feel strongly about.
Thank you, Molly. Thank you so much. Well, we have another question here, and I will say this is for Peter. Now, Peter, I was really intrigued by your mention of barefoot innovators. Now, perhaps it's just me, but I hadn't heard that term before, and it really made me think. And we have a question here about, does World Concern have any sort of standing agreement on an intellectual property sharing, whether that be with a university or sort of code of ethics in this regard?
Yeah, we do have, so what we have is a beneficiary protection policy, a statement that we try to follow to ensure that we protect and respect the communities we serve. So we require those we work with to look at that and see whether they're in agreement with that. And yeah, it's something that we have been developing, and we just passed it. So it's now in place. So yeah, we have something close to that. It's not specifically intellectual property thing, but it is the whole concept of beneficiary protection and ensuring that we are not taking advantage of vulnerable people.
Thank you. And let me just, since that was a short question, I'll pose one more to you as well. This comes from the audience. The way RFAs are structured by funding organizations greatly influences the work that researchers do. Problem statements are often put out in search of research that matches problems. In what ways do you think community partners, researchers, and funding organizations can work better to define problems and find holistic solutions that are effective?
That's a very good question, and we've seen that a lot, you know, because we respond to a lot of requests for application and a lot of call for proposals. And what we have taken upon ourselves is also to help educate the donors who write those documents, because they also want good results. One of the things that we found is that a lot of dollar money has been put out there within some of those communities, but we don't see change. And the reason is we have tried to address the symptoms rather than the problem themselves. So talking with the donors as we respond to those RFAs, saying this is a problem, but we need to get deeper to the problem. Ask ourselves, why is it that this community doesn't have clean water? Why? Why? You know, and then if you go deeper to that, then we analyze the problem to the extent that you are able now to address the root cause of the problem, rather than just addressing the problem itself. So, and that would be helpful in doing the log frame, like doing the problem tree, doing the result framework. As we present those documents as attachments to their proposals, the donor sees that we went far beyond what they asked to respond to their call, and that analysis is very, very helpful. And when we are working with the community, helping the community understand we're not just here to drop things to you. We are here to facilitate a process that probably in the next 3-5 years, you will not need us. One of the reasons why organizations have remained in the field forever is because they continue creating dependency on the communities. And that dependency syndrome, the community likes it because they get those free things falling down from the NGOs, from the nonprofits. But if we could help the community understand the process, that we are empowering them to be able to do these things for themselves. And probably in some of those places, they have all the assets and the resources that they need to get out of the situation they are. Then we'll have a better response and we'll be a bit more successful.
Thank you so much, Peter. I'm going to jump to a question here that I think is relevant, especially to those students who may be tuning in today. And I'd like to pose this to Molly to begin with, and then ask Rajani to also comment on it. But how do we practice these human-centered design skills before we get into the field?
Well, I think I do think it is a skill. I mean, there are lots of tools and resources, and it's a skill, but it's also a mindset. And I think the mindset is the hardest thing to kind of embrace. So I would just say it's possible to practice it just in your life. I've just found it quite interesting how since I've been, really doing a lot of human-centered design, how I find that like it applies just to so many different things. And it's kind of fun because it's a really just offers a fresh perspective. So I guess I would just in pragmatic terms say, encourage people to look up IDEO is a favorite, but there's also so many resources out there that are free. So I do urge people to just check it out because I think it can be really helpful for just a fresh perspective.
Thank you so much, Molly. Rajani, did you want to add to that at all? Are there any approaches that you would encourage them to take?
Yeah. So I wanted to add on the earlier question and this question as well. Like it's also very important that all the different stakeholders bring in their expertise in the area. So like by the researchers, the technical expertise could be brought in with reference to what could be the research questions, what could be the research designs, after understanding the needs and issues and the problems which needs to be say catered with. And the community-based organization do have an expertise in what are the issues among the community members, what are the demand among the community members, and so how do we co-create the process along with the community members, community-based organization and the researchers. So each of the stakeholders bring their own expertise in that, and that would really help. And then the approach at SEWA, what we take is we also train the grassroots researchers. And so they are like the expertise from the expert researchers would come in, and then the grassroots researchers are trained so that the field related work would be done by the grassroots researchers. So this would also help in building in their knowledge and their capacity as well. And once they are acquainted with it, they really feel they are also part of it, and the ownership does come in that.
Oh, thank you for that. Well, I think we have time for one more question, and I'm going to meld together a question from the audience here with one of my own. The question being, what's the most important, and let's start with Molly on this one, because she really touched on this, I think, most in her presentation. What's the most important thing our researchers can do to accommodate gender, equity, diversity in the context of human-centric design? And then I guess I was going to ask, can you just, again, talk a little bit more about this intentionality in ensuring equity?
Thank you. Yeah, I think it's, essential to be intentional. And by what I mean by that is that one, that there's a diverse, there's a diverse group. So it doesn't mean that, I think there actually is a benefit to having lots of different perspectives, even in addition to maybe the communities who are affected, but the power dynamics are where you really have to be intentional. So if funders are calling for this, and this came up with the RFA question, if funders are saying, what do you want? Then people will say, oh, well, we want this, which is, they're like hedging, like what you can give us. But so I think it's really the authenticity and actually, again, Peter's point about not being extractive, like being authentic and intentional, and having people not just at the table, but genuinely, driving, genuinely listening, genuinely understanding, asking the why, what are the issues, and then valuing that. So if there's no time, if there's not enough time and there's not enough resources, either don't say you're going to do it or do it correctly, do like part of it. I think that just there's a lot of mistrust that can come from not doing those things. So having the right people at the table to begin with, but actually driving and having the power to have their perspectives valued and heard, and driving the decision points at all of the critical parts.
Thank you, Molly. I think this was actually a really perfect point to end on, that really encapsulates all that we've been talking about today in terms of human-centric design and needs analysis. So I would like to, at this point, unfortunately, we are out of time. So at this point, I would like to turn over the floor to Rhonda Hahn. She has some closing remarks to make, and a reminder that we have another panel tomorrow where we're taking this conversation a bit further. So with that, Rhonda?
Thank you. Thank you so much, Heidi. Thank you to all of our panelists. This was absolutely fantastic. It was very informative and helpful. And I've taken away a lot of really good pieces of information to use. And I really appreciate that all of you have given us your time to speak to our audience and for sharing your knowledge and expertise. So join us tomorrow at 11 a.m. for a panel discussion on iterative implementation and adaptation. So everybody have a wonderful day. Thank you.